Hi, today I'm going to show you the exercises and stretches will enable you to treat the sciatica pain and get rid of that annoying pain. My name is Ammar, COPA practitioner, CT clinic. Due to the amount of the request and the question I have been banded with, so I am going to do this episode. It's going to be a little bit more than a couple of minutes. Let's just recap on how the actual sciatica pain and how the nerve got trapped. If you look at this picture, the nerve is trapped. But how does this actually happen? If we look at these discs between these two vertebrae, now these discs will expand because these two vertebrae come close to each other. These two vertebrae, to come close to each other, they have to, it's either by the actual disc collapsing or these muscles here, they will actually shorten, tighten, and they pull these two vertebrae close to each other. However, this nerve could be trapped anywhere in the pathway of the actual sciatica nerve. So to reverse this, to do this, any treatment has to and must be based on breaking that lactic acid here in the muscle, and then after that strengthen this muscle. The sciatica pain treatment is not as people think it is. It's not just an infection, painkiller or injection, and the pain is gonna go. So I believe I developed a very unique total care system. It's called COPA therapy, and I need on average 8 to 10 sessions to treat the sciatica pain. What does this tell you? It's not just a one day or a couple of times you do the stretches and the pain will go away. The pain, it's a very complicated to treat and a very complicated to actually diagnose. So for this, I am going to show you a lot of stretches, but these stretches will target these muscles here, and then after that muscles on the side and muscles on the glutes, just to cover everything, because I don't know where the actual U nerve being trapped. Now, if you look at this picture here, you've got this first layer, you've got the second layer. If we cut this off, we've got a third layer and a fourth layer. All these muscles, the nerve could be trapped anywhere because of this muscle. So just to actually insist of saying this, treating sciatica pain is not as easy. Even sciatica pain is got a different stages. So I am gonna try to cover all the stages. Let's just go and see how we're gonna do this. The first exercises or stretches, you lift your leg on something where what you're trying to do is make your lower body is away from the upper body. So you fold yourself so the muscles from the back will stretch. So what you aim is to touch your toes. However, when you have a lot of pain, you might just be able to get to there. Then when you actually feel the pulling sensation on your back on that side, then you stop and you count to 30. It's gonna feel like it's ripping off. It's gonna feel like it's gonna rip, but that is the normal. That is what you call a stretching pain. So I'm not gonna repeat this. This is the only time I'm gonna talk about what feeling you actually gonna have. So as what I said, you want to do this. To prevent it, this is what you need to do. But to prevent it more, this is what you need to get to. Okay? And we also do this on both legs. So we do this leg, even if you don't have pain on the left side, you still do the left side. Let's move to the second one. This one is what you call the patient favorite one, because it's easy and it's very accessible, and you really feel the stretches, and they're not very hard stretches like the other one. So you lie on your back, the aim is to the knees to touch your chest. So if we lie on the back and then we try to pull both knees together, close, and then you feel the pulling sensation in the back, and you count to 30 seconds. Let's move to number 3. This is a little bit similar to the second one, but this will actually get the glutes going a lot. So what we do is we lie on the back, and then we cross the leg this way, okay? And then after that, we pull the other leg on the side, okay? You will feel pulling sensation there and pulling sensation on the lower back. And again, you count to 30, and again, you do both legs. This is my favorite. I like to stretch my glutes because I know how much pressure the glutes are, but also the lower back. So what we need to do is sit on the side and try to lean forward As soon as you feel this pulling sensation, then you stop and count to 30. So you will feel the pulling sensation on the same side of the leg, not the opposite side, but sometimes you will feel it on both sides. So you aim at the end is actually to touch your toes with your head. Okay, so I've seen some people doing it this way. This is still okay, but this is the way how you get the maximum of this stretch. Let's move to number 5. Stretch 5, you lie on your side and then you leave your leg out of the bed for the weight of your leg to do all the work and all the pulling sensation. So what we do is we lie on the side, and then after that we leave this out, and the weight of this leg will pull and stretch the muscles on the actual lower back. Okay, always remember we do this on both sides. You don't just do it on one side and 30 seconds. Let's just move to the number 6. You leave the best to the last. This is what I call a master stretch, not because it's better than any other stretches, but because it's very easy and very accessible to do it at night just before you go to bed while you're holding your phone. So what you do is you lie on your back, okay, you cross your legs all the way. So we don't cross your leg this way, we cross your legs all the way, and then after that we lean into the side, into the right side. It's important to make sure that the shoulder stays there, so you don't lift your shoulder, otherwise we're not going to get no benefit. So then you will feel that pulling sensation there. When you feel the pulling sensation there, you will count to 30 seconds. After seeing the stretches, now I would like just to stress out a couple of things. The first one, each one of these stretch has to be done 4 times or 5 times at one time. So you do them once, twice, 3 times, 4 times, 5 times, and that's what you call one. Now you must repeat these at least 5 to 10 times a day, and you must repeat it into 2 to 3 weeks before we see an improvement. You will see an improvement straight away after the first or second day, but then I am talking about the longer improvements, if you like. So like I said to you before, it depends how severe is your pain. Stretches will help you accordingly. So if your pain is only just started, these stretches will absolutely cure your pain. But what we need to remember, to avoid these again, we must stay on the top of them, and secondly, we must avoid any posture will make this pain coming back, because remember what we talked about is what is the cause of the sciatica is the tightness of the muscle. So if we have a bad posture, these muscles will be tightened again. So this is why I recommend you to go back into my other episodes where I talk about how to avoid pain, sitting down, sleeping, picking up things. If you like this episode, please like, comment and subscribe to our channel. Thanks for watching, and I'll see you in another one.